if an office wants to have an individual meeting, we have our annual conference is taking place at the Concourse Hotel, and Bob Jones has arranged for 4 or 5 of the directors to be in the building on Wednesday afternoon. If there are specific issues that you'd like to address, you can contact me and we'll arrange for a visit. There are several legislative offices that are here. Lieutenant Governor's office is present, so I want to thank them for being here. And with that, Bob Jones, come on up.
Gary, thank you very much, and good afternoon, everyone. Thank you for coming in for this event. As Gary mentioned, I am the Executive Director of the Wisconsin Community Action Program Association. WISCAP is the trade association for Wisconsin's 16 community action agencies and 2 statewide organizations, the Foundation for Rural Housing and the United Migrant Opportunities Service, or UMOS. Community action was formed out of the war on poverty half a century ago, over 50 years. And the idea behind community action is as powerful today as it was then, is local organizations that are locally controlled by community leaders, by government officials, by low-income people themselves in the locality, decide what programs, what needs are there for them to help low-income people get out of poverty. And for 50 years, those agencies have been serving their communities and serving the low-income populations, helping them achieve self-sufficiency through good times and through bad. For the last 4 years, we have been supporting the work of the Institute of Research on Poverty in producing its annual Poverty in Wisconsin report. I believe this is the 9th year overall for the report. The Institute for Research on Poverty is a very unique organization. There's only one of them. That's the only one in the nation that is designed to do research and to examine poverty issues and how they can be applied to operational aspects with the local agencies. It's been a very worthwhile relationship, and one I hope and look for us to grow with the Institute over the years. The former head of the Institute is Tim Schmeeding, who is the main author of the report. Tim is the Lee Rainwater Distinguished Professor of Public Affairs and Economics. And as I said, he's affiliate and former director of the Institute from 2008 to 2014. I have to mention this because I'm such a fan. He was recently, earlier this year, named the John Kenneth Galbraith Fellow for the American Academy of Political and Social Science. And is the founding director also of the Luxembourg Income Study, having served in that role from 1983 to 2006. His recent work has been on social and economic mobility across generations, inequality of income, consumption and wealth, and poverty in national and cross-national contexts. As I mentioned, he has served as the sole or lead author on the Wisconsin Poverty Report every year since its inception, including this one, and that's why we're here, is for Tim to share with us the results of the most recent report and the status of poverty in Wisconsin in May of 2017. So without further ado, I'll turn it over to you, Tim.
Thank you, Bob.
Oh, I think I took your papers with me here. All your notes. You didn't memorize things, I bet, right?
No, I've learned how to do this without a lot of extra.
Okay.
But I brought this stuff. Hi, everybody. Thanks for coming out. I'm Tim Schmeeding, and my co-author is Katie Thornton, who's a programmer at IRP. And the report is co-sponsored by WISCAP, as well as the Institute for Research on Poverty. In 2008, when I came here, somebody had invited me to have lunch with Governor Doyle. And he said, I want to join other states. We want to have poverty in 10 years. And I said, no. He said, what do you mean, no? I said, not now. Why not now? I said, we're going into recession. There's nothing you're going to be able to do to really stop things from happening. So he formed a study group, of which I was a big part of. We made sure that people who were eligible got the benefits they needed, and he asked me to start doing this, got some support, and here we are. And that was 2008. Now it's 2017, and we're reporting for 2015. I'll explain why. And it's the opposite. It's good times. The economy is on a roll, and we're doing much better this year than we have any time before since we started doing this in Wisconsin. So I want to give you a quick rundown on the facts and why, and then I'm happy to answer any and all of your questions. So we want to talk about the Wisconsin poverty measure, which is different than the official one, and its history, its findings, FRO 2015, that's my own early morning English, FRO. Current levels, poverty rates, what we find and why. So let's move on. The Wisconsin poverty measure, in 2010 we did our first report for 2008 data, and now it's 2017. And along the way, a number of other states and the federal government developed a similar poverty measure called the Supplemental Poverty Measure. Well, why did you have to have that? What's wrong with the official one? Well, the Supplemental Poverty Measure counts things like refundable tax credits and SNAP, food share, food stamps, which really have a big impact on poverty. And we weren't seeing that, and still aren't seeing that in the official measure. So we needed one that showed it. And my own chancellor, Becky Blank, was the mother of the federal Supplemental Poverty Measure. Of course, she wasn't here then. We just designed a Wisconsin one that was similar. We've since taught California how to do it, Colorado how to do it, and Oregon next year. New York does it. A number of states do it because people are interested in what's going on in their own state, what's happening in my state, what's happening to our programs, which we run. Even if we don't pay for all of them directly, we run them. So here's a quick guide of all you need to know. If you can't read the print, it's okay. The official poverty line was developed in the 1960s when people spent a third of their income on food. So they took the minimum subsistence food budget multiplied by 3, that's the poverty line. Since then, it's only adjusted for prices. So that's like 50 years old, okay? Resources were cash then, okay, without any taxes. So you counted earnings and things like that, but then we counted Social Security, supplemental income security, and unemployment insurance, and all these things that sort of came from nowhere because no one paid any taxes. But that's what we had, okay? And the only family they considered was a census family unit, which are all people related by blood, marriage, or adoption. So in other words, if you're living with somebody and sharing a house with them and you're not married, you're living together, you're treated as 2 units, not one, which doesn't make a lot of sense. So in came the Wisconsin measure, and it's based on basic expenses for food, clothing, shelter, and utilities. It's averaged over 3 years. It's produced by the federal government. We adjust it for Wisconsin cost of living, housing, tenure, and medical expenses. We have much more comprehensive, as you will see, family resources, which include taxes and credits. We also take account of work expenses. It doesn't make a lot of sense to count benefits from going to work for refundable credits without taking account of things like childcare and transportation costs, which you need to get to work, okay? And it has an expanded unit. We keep unmarried partners we treat unmarried partners as a single family unit. We include foster children, which the official poverty measure never did. Don't ask why. And we toss out college students who do not work. If you leave college students in who are living in a dormitory, they're out of this universe. But if you go knocking on the doors right down here, 5 blocks away, you're going to find a lot of kids who are unrelated individuals who are poor, with BMWs in the side yard and so forth. We don't want that. We throw them out. We're teaching the feds how to do this now. You don't want to count those people as poor. If you're a graduate student who's trying to support their family and you're living in Eagle Heights and you got a kid, you're in. Okay? You're a teaching assistant, you're doing something, you're trying to support your family. But if you're, they're all gone now, some of those other kids, you're not in. And that makes about a 2 percentage point difference. Makes a big difference in poverty, particularly among young adults. Okay. So, we use the American Community Survey because it gives you reliable state level estimates. Okay. The poverty thresholds are adjusted for Wisconsin cost of living and Wisconsin differences between homeowners and renters. So the cost of living in Wisconsin is 92% of the national average. That's the first adjustment. Within Wisconsin, if it's $1 on average in the state, it costs you about 90 cents up in the far northwest, and it costs you about $1.17 in the Milwaukee suburbs. We adjust for that too. what you have to buy, particularly housing differences. We model taxes, the federal Wisconsin tax laws. We use administrative data from the state to put in SNAP benefits, housing assistance, energy assistance, okay? So we're counting everything. Every dollar that got put out there is counted. And child care and work expenses are based on federal data. Other work and medical cost expenses are based on regional estimates. So we want to take account of all of these things, and I'll show you how it all fits together. So we're going to tell you what I found, what we found. Where are we in this year? How did poverty change? Now it says here the start 2015. The way the ACS is collected, every month somebody goes around Wisconsin finding another 20,000 people or so and asking them questions. And they say, what was your income last year? So in January 2015, they give you your income over calendar year 2014. And you go month by month by month. And by the time you get to December 2015, you're counting income from November 2014 through November 2015. So this is the only economical way to collect it. So we're looking at a 23-month period in all when we're looking at incomes. And these are the latest data available. In just in December 2016, we got the files, the raw files, that we could start to work with. Okay? There's 3 different measures of poverty we use. Market income poverty. The Census Bureau doesn't do this for some very strange reason. Market income poverty is essentially poverty from your own efforts, okay? It doesn't count taxes that you pay or income benefits that you receive. All it counts is your earnings, income from investments, private pensions, and private transfers like child support. It's what you would do on your own, essentially, or from members of your family, okay? Then we have the official poverty measure, which I just described, which is only cash programs and no taxes. And then the Wisconsin measure, which includes taxes and benefits. Well, you need all 3 because, first of all, you want to count all the benefits and taxes. We spend most of our money on refundable tax credits and on food share or SNAP. We don't spend it so much in cash programs, so you have to know what we do with this money. Does it work? And then the reason for market income poverty is because for most able-bodied people, I think we all agree, that the best solution for poverty is a job that pays enough to keep a family from being poor. Not all jobs pay enough. There are parts of the state where there are lots of jobs, other parts where there aren't any. These are all things that are important too. But the solution is a job, not a permanent income support program unless you happen to be elderly. I've said this for decades. Okay? So that's why we have 3 measures. Now, on the left is a market income measure, and the market income measure for everybody is about 23%. For market income for families and kids, it's 21.6%, means they worked a little more. And for the elderly, it's 48%. Of course, most of the elderly are retired. They don't earn their way, okay? So in other words, what happens is Social Security comes in, and it takes this almost 50% elderly poverty rate, and it lowers it to 6.2, according to the official numbers, okay? The Wisconsin poverty measure is a little bit higher for the elderly. Why? Because they have medical out-of-pocket expenses that we don't take account of. The budget is very narrow. Food, clothing, shelter, and maybe 10% more. That's all. So if you have big medical out-of-pocket expenses, that'll push into poverty. If you have spend a lot of money to go to work, you have to push it into poverty. So those are the market ones. These are the official measures. And you can see the official measure for kids is 15.4%. The Wisconsin poverty measure for kids is 5.4 percentage points lower. 10%. Why? Because kids get refundable tax credits. Their family size adjusted. The more kids you get, the more benefits you get. And because SNAP also counts the number of people you're trying to feed. So there's a really big difference between what the official rates show and what our rates show. Okay? And the overall rate went from 10.8 to 9.7. So this is just this year. Here's the trends. Okay, you can see the recession came in, people lost jobs, market income poverty went up, stayed flat for a while, and then boom. And finally this year, it kicked in and it fell. And it fell by 1.7 percentage points. It fell by a good chunk. Okay? The official poverty rate went up too, it stayed high, and it started to fall last year too, primarily for the same reason, because of earned income, recovery of the recession. And here's the Wisconsin measure, which was below the official measure and stayed low in the Great Recession. Why? Because the American Recovery and Relief Act benefits really worked. Part of what came out of the Doyle Committee was that if you're eligible for these benefits, you should get these benefits, and people got them. This isn't, you'll see in a minute, these aren't just people who are, you might call, oh, they've been on these programs forever in Central City, Milwaukee. That's not who it is. It's mainly other people in the state, people who laid off, people in Janesville, people who really were hungry. Even today, if you go to a food stamp office and say, I need help, I can't feed my family, a quarter of the people who show up today have no countable income last month. Nothing. You need this to eat. Okay? So anyway, this includes all of that. So here's, in other words, from 8 to 11, the Wisconsin poverty measure fell, the market income measure and the official went up. Why? Recession. Loss of jobs and earnings, less cash income. They were counteracted by the American Recovery Relief Act expansions, and legislation expanded the child credit, the earned income credit, the making work pay tax credit, a 2% payroll tax reduction. All of these things we did to make income go further for people. And then we expanded the maximum SNAP benefits from April 2009 through November 2013. Then we cut them. For some reason, people needed to eat more. People at the same income level needed to eat more in 2009, 10, 11, but at the end of 2013, they didn't need to eat as much, so we cut it back. Don't have. This is what we did. And obviously, when more people are jobless and are running out of money, more people are eligible for these programs. So even without the legislative changes, these are automatic stabilizers. They go up and they kick in when the economy turns down. 2012 to 14, the last couple of years, things were pretty flat. Everything's fluctuating, modest increase in jobs, but not enough and not great jobs in many cases, so we saw a little change. But finally this year, poverty is falling, and it's led by the drop in market income poverty. So in other words, earnings are leading the way. Alone, earnings aren't enough by themselves to bring most people out of poverty, certainly not families with children. But the safety net with jobs really works. And so the poverty reductions are reinforced by the safety net, although they're shrinking a little bit. As we know, able-bodied adults without dependents, those are ABOUDs, faced work tests in the last year or two, and about 40,000 people lost their SNAP benefits because they couldn't find jobs within 30 days. Many of them were people who'd been released from prison who couldn't get hired, but in any case, that was done. And then there was this reduction in SNAP benefits, which shows up this year too. So those two things have reduced the program. So here's jobs in Wisconsin, okay? This is from the total non-farm employment from the Bureau of Labor Statistics. Here we are, the high water mark is I think March 2008, and then big cut. Coming back. In March 2015, we finally got back to where we were, and now we're a little bit ahead of it, although it's flattening out. So here's the story for Wisconsin according to this data set, and we're mainly following the hard line, which is a seasonally adjusted line. You know, jobs bounce up and down in the summer and in the winter, and if there's storms or whatever. So we use the seasonally adjusted because it smooths things out. Here's the annual job gains in Wisconsin, non-farm employment, seasonally adjusted since January 1st, 2012. 14,000 jobs in 12, 28,000 in 13, 14 and 15, 42 and 32. Really good years. Now next year, 10,000 jobs in 2016 are all we get. Okay, so the steam behind our recovery is slowing down. We're still gaining jobs, but we're going slower. And then, so the jobs gained between January of 14 and November of 2015 were about 70,000. And that's when the report says 70,000 jobs, it's over those 23 months. Okay? Now, here's the SNAP program. Okay? Over here are the number in Wisconsin, over here are the numbers in the United States. And so Wisconsin's program went up faster in the Great Recession than the whole country. We jumped up above them, and now we're falling down below them at the very end. All right? The big jump was outside of Milwaukee, which has come down a lot with the recession. Milwaukee, which was already pretty high, went up, and it also has come down a little bit. But this is what you would expect in any case in a program that depends on labor market performance and earnings, and if they fall, you'll get more. Rules and regulations also make sense. We didn't have an asset test. People get debit cards. We won awards for reporting and being flexible with our program, and now we're sort of sliding down the other way. Like I said, much of this should be expected. So those are two of the things. Now we're going to look. Jobs returned to March 2008, peak in March. Yeah.
Of that slide, is that related at all to the work requirements?
Yeah, over here. The work requirements and the cut in benefits starts here, and then the work requirements start here. But at the same time, Bob, you can't just pull those out because the economy is recovering. There are more jobs. More people are earning their way off of the benefits too. It's a very complicated thing to pull all of that apart. Okay? So we returned to the March 2008 peak jobs in March 2015. So it took us 7 years to get back to where we were in terms of employment before, and now we're in front. And the biggest gains are over the period of this report, so you'd expect the biggest effects. SNAP shrunk, safety nets, we talked about that. And other things that are important are higher out-of-pocket expenses and payroll taxes. You have higher work expenses if you work more. Okay? Makes sense. The more you earn, the more payroll taxes you pay. And medical expenses have continued to rise, as we know, all along. Now, we even did better, though, for families with kids. So here we are with families with kids. The labor market started to kick in with families with kids back in 2013. Okay? That is reflected in the official poverty rate. But the big difference, the huge difference here is because kids benefit tremendously from refundable tax credits in the SNAP program. That's the difference between this line and this line, okay? Those programs are helping kids eat, and they're helping kid mothers pay bills related to their work. So those are that's the major things that we're paying attention to. And if you see a star at the right, that means it's statistically significant, meaning it's really different from last year. And that's the lowest poverty rate, 10% is the lowest child poverty rate in the history of the Wisconsin measure. 9.7 for overall is the lowest measure. So we're on the right track so far. Now, if we do what all the people in the national news have been calling me about all day, if we end up peeling back all of these benefits right away, and if our job creation slows down, we're not going to do so well next year. But for right now, be happy. Be happy with both. For the elderly, poverty took a jump because Social Security benefits didn't go up, but the poverty measure did over this period. But now the elderly are at 6.2%, according to the Census Bureau, because of Social Security mainly, and 7.8% because of the Wisconsin poverty measure. And the biggest difference in Wisconsin poverty measure, healthcare costs are pushing this up. Medical out-of-pocket expenses. They're not a lot. We do a really good job for most of low-income families with children here in Wisconsin. So medical care expenses cause less of an effect than in the rest of the nation. But that's what we have. Those changes weren't significant. So you want to talk about all these levers, okay? How do you change poverty? How do you affect poverty, Professor Smith? Refundable tax credits. Money you get back after from the federal government. Your earned income credit. We have a state EITC too, you know. Child tax credits that are refundable. Those are on the positive side. Then you pay income and payroll taxes. So single people pay more in income and payroll taxes and don't get much in the way of the EITC, so they're net taxpayers. Parents, on the other hand, collect more. Non-cash benefits like SNAP or food share, public housing, LIHEAP, those are all things, more of those push poverty down. These two push poverty up. If you have more work-related expenses like child care, which is affected by Wisconsin Cares, our child support program, okay, and higher commuting costs, that's going to increase poverty because it costs more to go to work. If we would increase cares or reduce commuting costs, it works in the opposite direction. You need less money for that, you're less likely to be poor. And out-of-pocket health care costs are obviously affected by Badger Care, and if we can limit those, we limit their pushing up. So there's at least 4 levers you can use. Okay? These are just the effects of the benefit programs on everybody. I don't expect you to see the tiny things, but the last bar on the right here is 2015 and 14. You can see that refundable taxes overall had an effect. SNAP was bigger. Overall, SNAP is the biggest anti-poverty program we've got overall. Okay? Public housing helps some, but not enough. And those of you who have read my former student Matt Desmond's book, Evicted, and understand how tight the housing market is here, that's a difficult situation, particularly for families with children now. This is LIHEAP, which didn't have much of an effect. Now, these are work-related costs, and overall work-related costs are fairly high, and medical care expenses are up. Now, this drop in work-related costs reflects the drop in the price of gasoline overall. Why? Because when you look at families with kids, now the scale is different here. You get an increase in work-related costs for families with kids, okay, because more hours means more child care. Higher medical out-of-pocket expenses this year. Here, the refundable credits dropped things by 4% and almost 4% for SNAP. Now, you notice overall, we're talking about 2% or 1.5%. So the scales are a little different. So the main beneficiaries of the safety net are, who I think they should be, kids and their parents. That's who we're helping. We're helping kids. Remember, my friend and co-author Pat Moynihan once said, the biggest uninsured risk for kids is their parents because they didn't get to pick them. Okay? You got what you got. Right. So the highlights, SNAP is number 1 overall, number 2 for children, refundable tax credits, number 1 for kids, 2 overall. These are all things I just said. Okay? Medical expenses and housing benefits. Now, the nice thing is we can look within the state. Areas of 100,000 people are big enough to see what's going on within the state. So let me just tell you quickly, and I'll give you the numbers. The green areas here are no different statistically from the state, around 9.7%. Okay? The 2 blue areas, La Crosse and Milwaukee, are above. Those are still big pockets of poverty. People are hurting in those areas in general. The area west and north of Milwaukee, going great guns, thank you very much. And Brown, Green Bay, and Outagamie, Appleton doing well too. Okay? So the yellows are statistically better. So here's what we find. Poverty varies across counties within the state compared to the overall rate of 9.7. Milwaukee was over 16%, La Crosse 13%. That's statistically higher than 9.7. In the yellow before, the suburbs north and west of Milwaukee, Waukesha, Washington, Ozaki, poverty rates are under 5%. Significantly lower. In Sheboygan, Brown, and Outagamie, 6 to 7%, also statistically lower, and in Dodge, Jefferson, 6.5%. So there are more areas in the state doing better now than worse. But one of the big things that I don't have a lot of time to go into now, though, is there's the differences across areas. But within Milwaukee County, which has 6 different Pumas, big enough for 6 different areas, okay? Poverty rates vary overall from 10 to 37%, and poverty rates from children from 5 to 42%. In other words, if you live in central Milwaukee, even after counting benefits and work and everything, you're looking at over 40% poverty rates for kids. If you go to Whitefish Bay and Cedarburg and Brown Deer, it's 2%. Within the same county. Okay? And then the areas, the outlying suburbs, are doing even better. All right? They have even better child poverty rates. So there is a particular place we really still have to work at, where we still have big problems, and that's Central City, Milwaukee, and for lots of reasons that I'm happy to discuss. So, I want to conclude. During the recession, the safety net helped, and it's still helping. We should be, I said this every year, we should be happy about this. It works. Don't say we're wasting money, we're not. These programs are helping people stay from being poor. Now, what's being poor? About $25,000 a year for a family of 4. So a little more than $2,000 a month for a family of 4. We're not talking about a lot of money, okay? We are, okay? It offsets jobs and earnings during the recession. During the recovery, Job growth is finally kicking in. Okay? That led the way this year. Benefits fell due to recovery and some cutbacks. Payroll taxes, out-of-pocket expenses are higher because people are working more. Central Milwaukee is still struggling, and we have diverse but largely positive differences across the state. So what this measure does is it shows how poverty is affected by both the economy and public programs, and they're both important. Okay? I'm happy to send this to anybody. It'll be on the website at the Institute for Research and Poverty. But the big report's up, the summary's up, information on what we do technically, and something I've done because everybody's got a different poverty rate out there. So before I will talk to a reporter about poverty, I tell them they have to read the Consumer's Guide. So they have to understand what's this current population survey that comes out in fall, and what's the supplemental measure, and what's the American Community Survey, and what does it mean, and so forth and so on.
You just love giving assignments, don't you?
I'm happy to talk to them, but you answer the same questions 48 times. Yes, sir.
You alluded to it, but it sounds like you feel that any kind of food stamp cut that Trump is proposing, at least 25% next year, and Medicaid cuts would send these numbers back up.
Oh, yeah. Oh, without a doubt. There's little doubt. I mean, part of it is that there's problem of jobs in the middle of Milwaukee. We know that. We know that a lot of guys have been released from prison and are having a hard time finding jobs there. We know that there's a lot of single parents there who are far from work, and there's not much work there. Okay, if we were reasonable about it, if we provided jobs of last resort, that wouldn't happen. In other words, if there is no job, you say, fine, here's a job. We could subsidize a nonprofit. We could subsidize a private employer. Here's a job. You take that job, you keep your benefits. Of course, they'll be reduced if you work. And if not, you don't take it, then we're going to cut your benefits. Okay? Even for 20 hours a week. This is, by the way, this is what I've been talking to the national press about all day. Okay? This is what's about to be proposed in the budget. More work requirements for single mothers. In Wisconsin, the plan is 20 hours a week, which probably many could manage. I hope so, anyway. You can't get credit for going to school. We don't want people to, get degrees that could pay off in medical technology or anything like that. We just have to go right to work. That would be helpful if we had that sort of waiver too. But in general, as I understand it, they're not going to cut the whole schedule. They're just going to work test the program and work test public housing and work test lots of things. And if I had to do it any time, it would be now. It would be the time to do it. But do I think you should do it? No, I don't think so. I think there are places in Janesville. Read the new book by Amy Goldstein. There are places in this state where it's really hard to find work. And if you don't provide work, you got trouble. And if you don't provide child care, you can't go to work anyway. You have to have child care. If you want a single mother to go to work, you have to provide child care. They can't afford to do it otherwise. Okay? And so I don't know. We're going to try and get tough, I guess, and we'll see how it goes. But the fact that our job growth is slowing, as you saw back here, the 10,000, see things flattening out here, the jobs are growing. I don't know where the jobs are going to come from for more people to take. Okay, this goes through the end of 2016. This will be next year's report. This is this year's report.
Where did you find that 10,000? How did you get
it's right from the total non-farm employment, from the Bureau of Labor Statistics.
The monthly numbers?
Yeah, seasonally adjusted. Okay. Yeah, we get these from one of my graduate students, and I check them every year. There are other series you could use, but this is a reasonably good, solid, consistent series. Okay? Yes, ma'am.
I just had a question. I know there's always a lot of discussion in the communities about, unemployment numbers and poverty, and are we receiving the complete snapshot of who's really unemployed? So, like, if a person's working, they go into the unemployment, get unemployment benefits. How long are they tracked from the time they leave work until they re-enter the workforce?
Yeah, they're tracked by the state unemployment system for as long as they're eligible for benefits. And all those benefits extensions in the Great Recession really helped. But now we don't have those extensions.
Okay.
And low-income people who work part-time in retail jobs, right, they don't qualify for unemployment insurance. They haven't been an employer long enough and so forth. So unemployment insurance really worked when you're laid off from a manufacturing job, okay? That worked in the Great Recession, okay? But unemployment benefits aren't doing what they used to do now, okay?
So is there really like a pocket of these people that fall off of everyone's radar because they're just not being tracked by unemployment?
Yeah, there are people who are not in the labor force, okay? We call them NEETs, not in employment, education, or training. Now, I did a paper for the American Enterprise Institute for Brad Wassink, who now works over here for the governor, and he's at DCF, on the hard to employ. And my estimate is that in Milwaukee, based on 7 anti-poverty programs which were training men, 60% of the men who couldn't find jobs in Milwaukee had a criminal record. We released as many people in this country last year from prison as graduated college, 600,000. And the last to be hired. You got trouble, very easy. You can find out who's been imprisoned or not, and it's the last thing an employer will touch. And most of these guys are in the middle of Milwaukee, where we have, the most incarcerated zip code in the country, 57203, I think it is, according to David Pate, my colleague. And we have to help these guys get work. And the good news is I've been called by the governor's staff. I'm told that we're going to try and do some pay for success for these kids. In other words, to try and get private investors to invest in programs, and the private investors will be paid back if they succeed in keeping kids from going back from prison. Okay, and I'm all for it. I think this is the big hole. If you ask me why young people in particular aren't going back, how come they're not back in the labor market? It's because they can't get in the labor market because of this particular issue. Okay? There's other reasons. Older people may be disabled, they may be going on disability and whatever. A lot of people are aging out of the labor market too. But the big thing that we look at, rather than unemployment, our unemployment rate is low, but that's because a lot of people who graduated, particularly those with bachelor's degrees who didn't go to work for Epic or somebody, have left the state. Because we don't have that many really good jobs for college graduates other than around Milwaukee and around Madison. There are some, there's the commuting zone. It's what I call, hold on, whoops, there. Whoops. The suburbs over here, the suburbs of Minneapolis, right? They drive in and out. But it's hard to find good jobs here. We put a lot of money into manufacturing, and we've helped manufacturing recover some. But manufacturing employment in this country has been falling for 30 years, and it's going to continue to fall. If you want to be competitive in manufacturing today, you spend a $10 or $20 million on some really good machines and robotics. You hire 2 people who've got their degrees in engineering from the University of Wisconsin-Madison, and a number of other people who've been trained in specialized manufacturing, either by the company or in a community college, and that's it. So you used to need 100 workers, now you need 4 or 5 to produce the same amount. Productivity goes up. It's part of technical change. And we have to face that in this state. Manufacturing is never going to be the engine of employment it used to be. Never. It won't be. That's all. We're producing more, and we're producing it more effectively. But I mean, right now, who benefits from manufacturing is the simple answer, which I told the National Academy of Sciences in 2014. Who owns the robots? People who own the company own the robots. They own the capital. They own the machinery.
When you mentioned the work requirements,
yeah,
is Medicaid figured into that as well?
No.
How much of an impact do you think that will have?
I don't know, really. I don't know. It's hard. Drug tests haven't seemed to pay off anywhere. I mean, if you're taking people who are affected by the opioid epidemic and you're getting them into actual treatment program that could help them get better, I had no problem with that. But if we get rid of those programs, when you have flexibility to do what you want with Medicaid, then it's not going to help anybody. And I don't know the Medicaid, I don't know what those effects will be. I don't think anyone knows, really. Those are really difficult to estimate. It depends. Every state's going to have a chance to do what they want. I mean, most of this changes are going to be in terms of waivers. So there'll be a lot of discretion at the part of the state to institute work requirements this way and that way and change things the way they want to. And again, I tell you, I have had nothing against work. Work is the answer. But work at $8 an hour or $9 an hour without help for childcare and so forth is not going to get you out of poverty. You're going to need refundable tax credits. You're going to need SNAP. You probably will even need a little housing assistance if you really want to get yourself stabilized. Those are the things that help make the labor market work, particularly for single mothers who don't have a lot of job experience and any sort of degree beyond the high school degree. Those are the issues. I mean, that's pretty straightforward. By the way, there's a new National Academy of Sciences Committee on Having Child Poverty in 10 Years, which I'm a member of, and we're dealing with all of these issues at the national level. We don't have answers yet. We only met for the first time. But we're very much thinking about programs and policies that could really help support kids and families, and particular kids, and help keep them from poverty.
Thank you all. We are going to stay in this room for another 10 or 15 minutes. If you have any questions, or if you have a desire to have appointments set up with people for Wednesday, we will have people here in the Capitol that can help talk about Tim's report, and Tim is here to answer any other questions as well.
You know where to find me, meeting at WISC.edu. Everybody else can. Send me a note.
Of course, what he was referring to is tomorrow the president is releasing the budget with many of the programs that were mentioned in here as part of that. So before the press conference, news conference started, Tim was telling me the calls he's getting from Vox, New York Times, on down the list of people trying to figure out how that will impact the poverty in the state. So.
Well, I can't figure it out any more than I told you, because there aren't a lot of specifics at the moment. I mean, and it's just going to be proposed. Even people like Ron Haskins is telling the Washington Post that, you know, I don't think the Senate is going to go along with this, and a lot of other members who are much more in the middle in the House. We'll see.
Great. Thank you, everybody.
Thank you, Tim.
Thank you.
Okay, aye, people? Okay?
Yep.
All right. I'm here. You want to talk to me? Talk to me.